Another important concept for us to talk about is professional judgment. And we already touched upon it through our conceptual models. But essentially, we know professional judgment varies. Not only does it vary between country, which we've already seen in AAA decision to screen or not to screen, but it also varies vastly over individuals. So 2 doctors might not make the same decisions. We often say, hear doctors say, oh, I don't have a power to make any decisions anymore, the managers make it all. But actually, doctors do make quite key decisions. So the majority of the highest treatment costs, so whether or not you have a hip operation or not, no hip operation, does lie between the clinical judgment of the medical profession. Some limitations, but actually, the doctor is the one that decides to give you that hip replacement. But if you do decide to give you a hip replacement, it's $10,000, so it's quite a lot. Nurses can also make a decision. If you are a nurse and you decide to give a patient a very expensive dressing, silver line dressing, and you give all your patients silver dressings to help them have antibacterial benefits, that cost will be so much more different than if you decided not to give any silver dressings and just normal, the basic dressing. So it can actually have huge impacts. Other things that we know that professionals take to make decisions. We touched on this yesterday in our seminar. Professionals consider mainly three aspects: self-interest, patient's interest, and society's interest. As a clinician, not only if you're a doctor or a pharmacist, nurse, all clinicians do that in the health system. And when it's mindful that we should look at self-interest when we call it aspiration for income, enjoyment to work, and desire for approval from peers, I think it's important to consider all three of those aspects. And self-interest is not a negative thing, and only if the balance is tipped. It's not a derogatory term, and I think that's important to understand. If you had a doctor whose self-interest was so high that overrides society's interest, overrides patient's interest, that balance, when it goes wrong, can be very detrimental. But usually, when it's in check, there's no issue. As a patient, you obviously want your doctor to be purely in your own interest. But actually, as a good doctor, you will probably want all those three things. You want the doctor to be not only thinking about the patient in front of them, but have a bit of perspective of society and the importance of resources use. So you can argue that a good doctor is having those three things in balance, because we know that if you give one thing to a patient, someone else is not having it. So that's why of those three perspectives, and these things are not fixed, and that's why there is a variation in differences there. So this is quite an interesting piece where The Guardian is a newspaper from England, and this is not a scientific study, but an article from journalism. So this is a journalist. He actually went around London, one area of London, and sort of investigated journalism and went to different. He took his mouth basically to 4 different dental practices, and he just went along and said, "What can you do for me?" And so he went to these 4 different dental practices, and they quoted him on the same day these different figures for work he needed for his mouth, his teeth. Can you see that the first one said, just a routine checkup, £32, this is some time ago, more expensive now, but all the way to the last one said, it's pretty bad. I think you need a lot of work, £915. And that's just one mouth, one day, 4 different services. Look at the variation in what they're offering. You might speculate the reasons why, but from here we don't know the reasons why. We don't know if Nigel Mayer is actually being, the right amount. That's the right amount of work he should have done. And actually Pickering just didn't want to have the hassle, or whether or not there's something going on there that actually somewhere in between is the right term, we don't know, but actually it's just interesting, isn't it, to see this variation.